Maslow's hierarchy of needs: physical, psychological, social needs, self actualization, esteem, love and belonging, safety needs, physiological needs. So you have to take care of the learner's workers so that they can work to the maximum. In behaviorism, conditioning or punishment reward theory, action leads to stimulus, which lead to an action or response. That is like a lion in the circus who receive a stimulus and then there is a response and there is a consequence as a result of which consequence the stimulus is regenerated. Cognitism, brain theory, links with real life to put in long-term memory. That is small group discussion, question and answer, PBL and simulations. So the memory is working memory and then it goes into short-term and long-term memory. Constructivism is like constructing a house. School is the basis of a student's constructing knowledge, and at college or university we are just giving polishing or reshaping. So everyone is taking his own message out of whatever we are delivering to them. Basic educational strategies for adult learners are related to the relevance, engagement, effortful, social, practical, and spaced according to their needs. Social learning theory involves that teachers are role models and a person is working based on his social pressures. So the behavior, environmental factors, and personal factors make a learning possible. There are different ways of teaching, including lectures. Lecture has advantages that are in an efficient way and they deliver a concise material and they can be used for delivering a short message in less time. But it is difficult for the attention span to be more in these people who are attending a lecture. So general concept lectures are good, but the successful transfer of information is dependent upon how better the lecturer is himself and how well lecture has been prepared. There should be a 10 minutes attention span. To put a twist at 10 minutes intervals, hook, grab attention, give prompts. Last lecture, linking are good things to and introduce into a lecture. You can give questions from university exams and they would attract the students. And basically, a lecturer is a leader. Lecture has main element that should be involved for active learning is talking and listening, writing, reading, and reflecting during a lecture. So a lecture has three parts, including introduction, body, and conclusion. So Gandhi 9 events are gaining attention, informing learners of objectives, stimulating recall, presenting content, providing learning guidance, eliciting performance, providing feedback, assessing performance, enhancing retention and transfer. Cognitive domain: remember, understand, apply, analyze, evaluate, create. Psychomotor domain: imitate or copy is 1, assist is 2, under supervision is 3, and automaticity is before. Effective domain is only 1A, and the student has to show his effective skills on skills test, etc. So whenever you are making learning objectives, they should be specific, measurable, achievable, realistic, and time bound. Bloom taxonomy is used for testing and curriculum development. There are 7 steps in PBL. PBL is student center, that is, there is a scribe, there is a chair in every group. They first define the terms or unfamiliar words of the problem, identify the problem, analyze or brainstorm, map or structure the learning objectives are decided then, and then everyone goes to private study for library or their home or their some place else. Next session after 1 week for step 7 they gather themselves. Till the step 4 they don't use any resources, for example Google. So community-based medical education is in community, which prepares students for a low-cost, low-tech environment to handle common issues which he may not encounter in a tertiary care hospital. So, student selected component. Selected component should be correlated either to core or to optional curriculum from 2 weeks to 8 weeks. Teachers to student centered, rightly structured to loosely structured, content driven to context driven, surface of strategic learning to deep learning, summative assessment to formative assessment. So student selected component give more time for relevant topics like research is obviously more these days. Teacher centered is tighter schedule. If they make everything teacher centered, it would be a tighter schedule and it would require a lot of resources. Context or student driven is loosely structured. Medical journalism, research, education, ethics may be student selected components. There are three types of study guides: content driven, that is anatomy, activity driven, management driven, for example telling what to do and where to do; context driven, that is hospital work. Professionalism is a social contract, which is expectation and obligation. Curriculum map is used by all stakeholders. Sharing level is a separate teaching by each discipline. It is level 6 of integration. Correlation with one joint teaching session with other separate session is level 7. Level 8 is multidisciplinary. Level 9 is interdisciplinary. Interdisciplinary means like disciplinary boundaries are abolished and you have a department of cardiovascular diseases as close to real life. For example, a patient comes with chest pain. One diluted utility index is validity into reliability into acceptability into educational impact to cost effectiveness.